Tech startup Zyla Health has raised $4 million in a Series A funding round led by Exfinity Venture Partners. Now, Zyla is going to use these funds to accelerate growth across its three key verticals, that is insurance, corporates and big pharma, as well as product integration across the healthcare ecosystem for scale. Now, in July last year, the B2B healthcare management platform had raised $1 million in a pre-Series A round. Max Life Insurance, HDFC Ergo, Pfizer, Zydus, DHL, IBM, and so on. These are just among some of the clients that it added to its portfolio over the last year. Joining me now to discuss this funding and Zyla Health's plans ahead is its founder and CEO, Khushboo Aggarwal. Khushboo, thanks very much for your time here on CNBC-TV18. Very briefly, if you could tell us about what Zyla is doing, what you're solving for, and how many patients are you currently serving on the platform?
Hi, thank you so much for having me over. At Zyla, our entire mission is focused on helping chronic patients improve their health. What we do is we diagnose the health of every individual. The individual may be coming from an insurance company, a corporate, or through a pharma partnership. And then we work tirelessly over the next few months to improve the health of this end patient. We are serving more than 1 lakh patients on the platform any given month who are coming from these various sources. Very happy to tell you that we have proven a very tangible ROI for our clients, for our insurance partners. We have showcased a 2.1x return on claim reduction. We have showcased a significant improvement in drug adherence and medical therapy outcomes for big pharma clients that we have. And we have also showcased a tangible outcome for our corporate clients, wherein we've reduced insurance premiums by more than 15% year on year by improving the health outcome of the end users.
So 1 lakh patients per month, that's what you're serving currently. To what extent do you anticipate this number will grow?
Yes, so we are looking to scale this up to 10 lakh patients, over the next couple of years. That is,
Okay.
by 2025.
Okay.
And we basically use technology very clearly in our entire patient journey process, be it a patient management system, how we capture data, how we enable 24/7 chat, or how we enable algorithms that will tell what is abnormal or an anomaly in the patient care journey that has to be fixed right now.
Okay, so a 10x growth, in the number of patients you're serving in just the next 2 to 3 years. I'm sure that $4 million that you've raised will help with that. How exactly do you propose to use it across these three verticals that you have? If you could take us through that.
Yes. So the number one focus is distributing Zyla more aggressively across the ecosystem. We, are hiring brand new folks with the dedication and mission orientation that we require to distribute Zyla across these three verticals. We are also investing quite a bit in product integrations across the ecosystem, which means we want Zyla to be talking through APIs to every diagnostic partner or physical infrastructure partner the patient may touch during this journey, apart from the digital care Zyla provides. So we are integrating the entire ecosystem through APIs, and that is also where the investment is going to go in. We also have global plans. We are launching in Southeast Asia early next year, and we also have plans to go further global to expand Zyla and touch 1 billion lives in the future.
Okay, 1 billion lives in future, but give us briefly a sense of what kind of revenues and profits you've been able to generate in the 4-5 year journey that you've had, and what the business model is really centered around.
Sure. So we have grown 300% since last year, since we raised our round in August last year. Right now we're clocking a 12 crore ARR in revenue. We aim to hit profitability and sustainability within calendar year 2024. And, the entire business model is based around subscription payments for patient care. We take care of a patient for 3 to 12 months, and our B2B client, which is a big pharma, a corporate, or an insurance company, pays for this subscription for this end user. So what happens in the ecosystem is that everyone wins, because this B2B client is paying for the care for this user, the health of this user is improving, and because I improve the user's health, I'm able to return an ROI to my B2B client, and it becomes a very sustainable growth trajectory.
Okay, we are reading that you've added Max Life, Ergo, Pfizer, I think IBM, DHL rather, and some of the other clients in the last 1 year alone. So, how many clients in total, with these names that you've added, and what's the plan going ahead?
Yes, so we have close to 100 large enterprise clients that we serve in various capacities. Our key clients include Aditya Birla Health Insurance, AstraZeneca, Pfizer, IBM, DHL, Godrej, as you rightly mentioned. We basically intend to capture 20 large insurers of the country, each scaling to close to 5 lakh managed lives each. And then we also want to scale to about 1,000 large enterprises and corporates to enable the growth that we envisage.
Okay, quickly, a final word in terms of the outlook that you have. The health tech space is very large for young companies like you. What does that mean in terms of, market opportunity and the share that you can capture?
Yes. So it is a pretty massive market. We're talking about 250 million chronic patients. We're talking about $1 trillion more spent, in terms of the economic loss the country sees because of chronic diseases every year. We want to basically, enable better health for the country, capture the entire digital health space and become the continuity of care ecosystem that the patient needs, and connect the patient with every physical ecosystem partner as well. So my dream for the country is that I'm managing 10 million patients in India, 1 billion globally, over time, the next few years.
All right, Khushboo, and we hope you're able to do that. Thanks very much for your time here on CNBC-TV18. Thank you.
Thank you so much. Bye-bye.
On that note, it is time for us to head into a short break. But coming up next, Lighthouse Canton's AIF closes fund with corpus of 350 crore rupees. Meanwhile, a McKinsey study has projected $10.5 trillion in damages from cyber attacks by 2025. We discuss that and more on the other side. Stay tuned.